Hi, everyone. Welcome to Co-Medicine. I'm your host, Dr. Sarah Boston, and I can barely sit down right now. I'm so excited. We have Glaucomflecken. Yes, that Glaucomflecken on Co-Medicine. I can't believe it. Dr. Will Flannery, just an amazing person who 3 years ago graciously agreed to talk to me about comedy and medicine because, kind of like this podcast, I love talking to people in healthcare who are comedians. He's been hugely successful with his sketches on social media. I'm sure you guys have watched them. If you haven't, you have to check them out. He also is a keynote speaker. He loves speaking to healthcare professionals. In September, he had 30 days of U.S. healthcare insurance where he is satirizing that whole situation down there, which is absurd and good fodder for satire. So I hope you will check those out. He really doesn't need an introduction. Why am I introducing him? I don't know. Let's just get to our episode because it was amazing. Please, everybody, welcome Dr. Will Flannery, otherwise known as Glaucomflecken. Welcome, Will, to Co-Medicine.
Oh, thank you. So good to see you.
It's nice to see you, too. So I'm going to tell a little story of how we met.
Yes, please do.
Well, we never met in person, but about 3 years ago, I decided I was going to go to comedy school. And I was like looking at, I don't know how I found you, but I found you because I'm a cancer survivor. And I found you and I was like, this guy's a comedian and he's a cancer survivor. He's a physician. And I was like, I need to talk to him. So I emailed you and I was like, will you talk to me? And you were so generous and nice. And you were like, yes. And then we talked.
I remember.
Yeah. So I went to comedy school. That's what happened.
I remember our conversation. I remember the email. I kind of remember the email. I don't always, because I get a lot of messages. And so I can't respond to everyone. So if I'll read all the emails like real quick, but then sometimes I just don't have time to like respond. So depending on what it is, I just loved what you had to say and your story. And I'm in favor of anybody like trying out comedy and just going down that path and seeing where it takes them. And so, yeah, it was fun to talk with you. That was 3 years ago now?
Yeah. Yeah.
No way. Are you sure? It was like 6 months ago. For
no,
sure.
No, because I went to school for 2 years. I graduated. I have a diploma in comedy now.
You have a comedy diploma. You're more legit than I am.
I'm very legit.
Great.
Well, I'm very, very legit.
And have you been able to get an entry-level position in comedy?
Yes,
with your degree?
I my vocational ticket, which is the comedy diploma from Humber College. Yes. Well, this is it right here. I'm a podcaster.
I'm dying to know what the curriculum like in comedy school.
There's stand-up, improv, sketch, screenwriting, sketch writing.
Are you taking tests? Do you have exams?
Yeah, I just would like you to know that I won the Academic Excellence Award.
You did? Oh my gosh. Does that get you an automatic entry into comedy grad school?
Even a better job, actually, is what it gets you in comedy.
Did you have to do any comedy research? Did you have to publish in comedy journals?
Yes. I have a lot of peer-reviewed journals in comedy.
Just a laugh track. Listen, this is what it. That's awesome. Congratulations.
Oh, thank you. Thank you. I'm not trying to brag.
I think it's great.
Just a bit of a nerd, Will.
Yeah, I love that your first inclination was I want to try out comedy. Let me go to school to learn about it. That's fantastic.
Nerd.
I didn't even know.
Nerd.
I honestly didn't know. I knew like Second City. I know that like, there's like comedy. I don't know what you call them, but comedy troops.
Yeah, yeah.
Second City is a comedy school, right? You
kind of. You don't get a diploma though. It's not a college. Well,
you probably don't get a diploma.
I wanted the diploma. Yeah. No, my husband didn't know either, and he came home, and I was like, "Hey."
Yeah, what's tuition like at comedy school these days?
It was expensive. Yeah, but it's okay. It was more expensive that I wasn't working. You know what I mean?
Yeah,
it wasn't so much the tuition.
You're like working as a vet, right?
Yeah. I'm a veterinary surgical oncologist.
Yeah, because I remember that's also what really piqued my interest is like, I love like anybody in like healthcare fields, whatever, human or animal, it doesn't matter. Like I support people like pursuing comedy. I think it's fantastic. There's a lot of material. There's a lot of material in what we do, right?
This is what this podcast is all about. Talking to people like us that are doing this. So now, I don't think I knew your name when I met you. You were just Glaucomflecken.
Yeah.
So I have
Yeah.
2 questions.
What's my name?
A, what is a Glaucomflecken?
Oh, okay.
And B, it seemed like you were kind of protecting your identity. I don't know if that's true or not, but it seemed like that at first. And then sort of as you got better known, maybe you just couldn't control it. But what was happening there kind of in the timeline?
Yeah, 3 years ago. So we're talking before my cardiac arrest, I was probably still mostly anonymous at that time
Yeah.
because I had not really explored the video medium as much as I do now. Probably maybe I just started TikTok or I was just about to or something. Which is even more surprising how you found me because I wasn't as big as I am now, I would say, as far as my platform.
No, you weren't, which I think is probably why you
I was like,
responded
"What?"
to
Like,
me.
yeah, it's right. I was just getting like one email a day at that
You're like, who
point.
is this person? Yeah. Yeah.
It's like, "Oh, a fan. Wow, I have a real one." All right, cool. So the reason I chose the name Glaucomflecken, people first of all, they think that that is my real name. Like I get
Oh, wow.
patients that call the clinic, be like, "Oh, can I have an appointment with Dr. Glaucomflecken?" And we have to
Amazing.
tell them it's Flannery. It's not actually Glaucomflecken. And they're like, "No, I want to see Dr. Glaucomflecken." And so it ends up being a whole thing. But it's an actual word in ophthalmology. It's an exam finding that you see in people with a certain type of glaucoma. Hilarious, right? Perfect name for a comedian ophthalmologist. But that's what I was doing. I was just trying to come up with the most ridiculous word in ophthalmology, which is a field full of ridiculous words. So I settled on Dr. Glaucomflecken. It was either that or Dr. Pseudophacodenesis.
Oh,
That
wow.
was even longer and a little bit too much, and so I went with the much easier to pronounce Glaucomflecken. Yeah, I was anonymous for a while. It was shortly after we talked back in 2020. I got on really when the pandemic, when everything shut down. I had all this time on my hands. A follower on Twitter was like, "Hey, you should start making some TikToks." I was like, "What's TikTok?" And I went and looked into it and I was like, "Oh, I could do a lot with this. I'm already telling jokes. I might as well just like turn it into a video format." And it's just blown up from there. It's crazy.
Yeah. You have over 2 million followers on TikTok. Is that right?
Yeah, TikTok's like 2.2, I think, at this
2.2.
point.
Oh, sorry.
Yeah. Oh, please
You're like, Sarah,
don't cut me short here.
that's
Let's
200,000 people that you're.
Yes. How do you think those 200,000 people feel right
They
now?
feel very disregarded. That's wild.
Yeah, yeah.
That is
I
a wild number of people to be watching your. I mean, they're hilarious. And you definitely found your stride on TikTok.
It is surprising, honestly. Like I obviously never expected like that many people to tune into this stuff. But what really helped me, I think, was just timing. It's like a lot of time success in whatever it is you're doing, even the world of social media, is all about timing. And I came along, started making this video content at a time when so many people in healthcare like needed to laugh about something because it was just a dark, dark time. And so I provided that outlet for people. And so, yeah, like all the videos I was making at that time were just taking off, going viral. I was gained a lot of my following kind of in that first year, just because there wasn't that many people out there doing that kind of medical based comedy, So it came along at the right time.
Yeah, you have a lot of fun making fun of different specialties and how they interact with each other. And one thing I love is that actually veterinary medicine's not that different. So I'm a
I hear that.
surgeon. I enjoy when you make fun of surgeons. It's quite funny.
Is it similar, like the veterinary surgeons? Do they have the same kind of God complex a little bit? They think highly of themselves, for good reason, because you do like incredible things. I mean, human medicine, sure, but like even animals, like you're probably operating on all different kinds of animals, which seems hard.
Other veterinary surgeons are like that, or people think we're like that. You know what I
Yeah.
mean? It's just like the attitude of like, oh, it's a surgeon, it's a diva, it's a whatever. I think, but it still kind of works. Like the things that you play with works for veterinarians as well. I was going to talk a little bit about. So you're an ophthalmologist.
Uh-huh. That's eyeballs for
That's
people that
eyeballs,
don't know.
everybody. Yeah, another weird word that's hard to
Yeah, that's
spell.
right.
Yes, too many H's. Why did you go into ophthalmology?
Well, I'll tell you, I had no idea what I wanted to do once I got into med school, and I knew I wanted to be a doctor. I didn't know what type of doctor. And I did a rotation, a required rotation in vascular surgery, which is an awful rotation. It's the long hours. It's like 4 a.m. is when you start. You go till like 6 or 7 at night. So long hours, the sickest patients in the hospital, and just lots of blood. So it's basically the opposite of ophthalmology in every conceivable way. But I really liked being in the operating room, but I hated that rotation. Every day I would go to the operating room and just like stand there. You probably remember what it's like as like a trainee, as a student. You do a lot of watching,
Yeah.
while other people are doing real work. You're like learning through observation kind of thing, which doesn't always work out well. But on that rotation in particular, I did a lot of standing in the operating room for hours, just standing there. It's like my legs were aching. It was awful. Listening to the attending like talk about his favorite compression stockings or something. I don't even know. But I just remember standing there one day and be like, there has to be a better way to do surgery than this. I want to be a surgeon, but I cannot stand like this and just do this type of work. And so I immediately finished that rotation. I started a 2-week elective in ophthalmology. And the first day I walked into the operating room, somebody offered me a stool to sit on. And that was it. I chose ophthalmology at that moment. It feels so good to sit. I'm sitting down right now. Isn't it wonderful? Like, I don't understand people that just, how do you do it when you stand? I don't know what your job is like.
Yeah. Vascular surgeons should know better.
Yeah, seriously, just have a seat.
Why are you talking about
Come
compression
on.
stockings and you're standing for 12 hours, right? Like,
Exactly. So really, ophthalmology, it's simple. Do you like surgery? Do you like eyeballs? Do you like to sit down? Those are the only 3 like data points you have to be able to answer. So anyway, I don't know. I like eyeballs. It's weird. I know it's a strange field, but
people
it is
like
what it is.
or hate eyeballs, I think.
They do. There's a lot of people. There's a thing. My thing is teeth. Like the dentist, I dread it. I don't like teeth. I got like sensitive teeth. I don't know. It grosses me out. I'm just like, hanging on for dear life when I'm getting my teeth scraped at the dentist or whatever the hell they do. But people have a thing for eyeballs. It's
Yeah,
like
they definitely
some
do.
people are like you can't come near their eyeball. They pass out when you get close to them. It's a known phenomenon, particularly with young men. By the way, like in their 20s, like they're the ones. If anybody's going to pass out from like just the most benign examination of their eyes, it's going to be like a 22-year-old man. I don't know if that's like a scientific thing, but it's anecdotally what I've noticed.
Yeah.
So yeah, people have it. Is that your thing? Do you have an eye thing?
No, I don't have an eye thing. I actually considered being an ophthalmologist when I was considering residency training, and it's a really nice man, but kind of old school. This is why I didn't. He goes, "You know what, Sarah? It's a great career for a woman."
Oh no.
And then I just was like, because this was a long time ago. But if he would have said it's a great career for someone who likes to sit and doesn't want to work long hours, I would have been like, I'm all in, who likes surgery. But because he said it's a great career for a woman, I was like, no, I'm not doing that. I'm going to be a surgeon. Like, I was like, I'm going to be a cancer surgeon. That's a terrible career for.
Oh man.
No, I don't know. Anyway,
you got some bad advice there.
I did.
I'm on my lunch break right now. I mean, come on.
Oh yeah, you're at work right now.
Yeah.
Oh.
Not
Ish?
really. I came home. Yeah, I work like a mile down the road, so I just came home.
Oh, that's wonderful.
I don't have pictures of my characters on social media at my office like I do.
Oh, okay, that's true. That's true. Well,
in my home office.
I wasn't scrutinizing it quite that much.
People that can't see this, but I have I have like a couple of characters. Jonathan, my loyal scribe, he's in a lot of my videos. And the neurologist. I have framed photos of myself in my background right now.
Yeah.
So
I love the neurologist.
Yeah. People either love him or hate him. Yeah.
I kind of love him. So, okay. So as much as you're comfortable about talking about this, we're both cancer survivors. You had cancer twice.
Testicular cancer. Yeah.
And that was in medical school and residency training.
Medical school or residency, 4 years apart. Yep.
And then you suffered a cardiac arrest. And your wife literally saved your life. Is that?
Yeah.
Like she did CPR until the paramedics came?
Yes. 10 minutes of chest compressions.
It's, I mean, that
crazy,
is
right? It's
Pretty,
nuts.
yeah, it's pretty nuts. Also, like, you probably have to buy her really nice presents now, right? Forever. Like,
Yes. What happens whenever your wife saves your life? You don't win any arguments anymore.
yeah,
It's over. It's done.
there's
Which is
no, yeah.
fine. I get to be alive. She gets to win the
She gets
arguments.
to win every
That's
argument from
totally
now
fine.
on. Yeah, I think that's a fair trade-off.
How many different types of animals have you done chest compressions on?
Really
Or does
mostly
that
just
even
dogs and
happen?
cats. Yeah, it happens.
It
It
happens, right?
happens. It's more dogs and cats that we would do that on.
How do you even do it? Like, are they on their side? Like, I'm just like, this is like super morbid, like conversation, but I'm just curious.
Well, sometimes people tell us, like, they're like, "Oh, I did CPR on my dog and cat," and maybe they did, but
Yeah.
probably they didn't. Probably their probably their dog passed out, and then recovered. But
Yeah, yeah.
they're like, "I saved him," and so you just go, "Good job."
Well, it's
That you
kind of like
can.
humans. If you start doing chest compressions on it and they like push you away, they probably didn't need the chest compressions. I imagine it's probably the same with animals.
They start kissing you.
They start, yeah,
They're probably okay.
that's probably. Imagine a cat wouldn't like that very much, though.
Well, people put their whole mouth around their dog or cat and then they blow and then they tell us that they did that. And I just, you know what? People are just
Hey,
putting good energy out.
yeah,
I'm just
they're
like,
trying,
good
doing
for
what
you.
they can.
They
That's
prayed,
right.
they did that. I'm just like, great. Whatever
It
you
helped.
did, it's helping. Yeah. So it's just energy. That's how
Right.
I see it. It's
That's
just,
right.
you're putting
Vibes.
good energy. But okay, your wife saved you. You've kind of experienced like having a cardiac arrest, but then also going through cancer treatment. Has that changed your outlook on medicine or comedy or both?
I'd say certainly like lots of things in life, it changes my perspective. Especially right afterwards, there is something to enjoying the day-to-day life, the day-to-day events, little moments with your family that you didn't think you'd ever have again. That does fade over time. You just get back into, your regular routine and rhythm. But there's always little moments that come up that happen where I'm like, oh, I almost didn't ever get to experience this. And so I kind of like them now, when that happens. And so I hope that feeling does persist, throughout my life, which so far it has. It's now 4 years, 3 years later. And then on the comedy side of things, what it really just my experience as a patient every single time, even with the cancer or the cardiac arrest or the dealing with insurance companies, that all has definitely impacted my comedy and changed my material and what I talk about, and just turning it into something fun, turning this terrible thing that happened into something good, something that makes people laugh is a really cathartic, wonderful experience, for me personally. Healing through humor.
Yeah. Well, I can definitely relate to that.
Yeah.
Now, stand up is kind of where you started. Is that right?
Yeah, I started in stand up. I grew up in Houston, so there's this famous comedy club called the Laugh Stop that a lot of famous comedians, got their start in Houston. There, unfortunately, that club is no longer around. But a friend of mine in high school, we would go and they had like once a week open mic, like 5 minutes, right? And you went up there and told jokes, and we weren't very good, but we kept at it. We got better, and eventually though, I did have to decide, like, do I want to do comedy like as a career? And I decided I didn't want to do that because it seems super hard. I don't know, very challenging.
Unlike
Not as
medicine.
as if yeah, as if becoming a doctor is any different. But anyway, but I kept it as a hobby, and so stand up comedy. Everywhere I went, either college, med school, I just found opportunities to keep getting stage time and practicing and telling jokes, and it was just pure fun. It wasn't something I was trying to make a living doing. It's just my creative outlet, and I was getting pretty good at it. Even in med school up at Dartmouth, with the Northeast has a pretty good comedy scene, like the Boston area, and even up to Burlington, Vermont. I was making a little bit of money. I think one time I made like $50. I was very, very proud
Big
of that.
time. Oh, yeah. Yeah.
Does that? I was technically a professional comedian at
Professional.
that
Yeah.
point,
If you get paid,
right?
you're a pro. Yep.
Exactly. But then like life got in the way of hobbies. Medicine is a somewhat demanding of a field to be in. So I kind of got away from it and came back in a different way through social media because I could do it from the comfort of my own home, while I'm cooking dinner and writing jokes on Twitter, or then later on making videos. So yeah, I started out in stand up, but my life, my career, just didn't lend itself to the time it takes to be like a successful stand up. And so I kind of just went at it from a different angle.
Yeah. I think I should have taken that advice 3 years ago when I talked to you.
I mean, I have so much respect.
it's-
Like I don't call myself like a stand-up comedian. I'm not. I'm not a stand-up comedian. That does a disservice to people who actually are stand-up comedians, because that is hard work, and especially to make it big. I am a type of comedian. I tell jokes. I get paid to tell jokes. It's different. I'm in this kind of niche, of medical comedy, where there's a handful of us that do it. I would feel wildly uncomfortable to get up in front of just your average Friday night audience at an open mic and just tell medical jokes. I don't know if people think the Krebs cycle is funny. The coagulation cascade. I'm not sure how many laughs I'd get at that. So it's definitely a little area of comedy that I've found myself in.
I think you still follow a lot of, I don't know, I think you like satire. It seems like you're
Oh yeah,
satirizing a lot of things about
I love it.
Healthcare and how we interact as healthcare professionals. So can you talk a little bit? I know you say you wouldn't classify yourself as a stand-up comedian, but as a comedian, like, what's your joke writing process? How does it differ stand-up versus writing your sketches?
You grew up in Canada, right?
Yeah.
I heard a little process. That sounded a little Canadian to me.
Yeah,
That's
I'll
okay.
say some oot and a boots if you want. Yeah.
All right. So yeah, my process is it's changed. Yeah, at first it was kind of arduous. I was not very organized with it. And I'm mainly talking about what I really enjoy the most is writing these skits. Writing scripts, the back and forth between characters. I think that's what I'm best at, is coming up with that dialogue and having these jokes evolve over the course of like a few different lines from different characters interacting and playing on their idiosyncrasies and the weird things that they do and different specialties in medicine. The way I started doing medical based comedy was really writing satire articles. So there was a website that's probably no longer around. It's called Gomer Blog. I mean, it's still there, but no one writes on it for. But it's basically the Onion for medicine. I would write these articles. I probably wrote like 100 articles for them about all these different specialties, and I really drew on that once I started making the videos. It really helped me to be able to tune into different parts of medicine outside of ophthalmology. People always ask me that all the time, like, how do you know so much about these different areas of medicine? Well, I've really been, I had to force myself to like learn about things that are outside my field. That's the first part of the process for me, is once I find a conflict in medicine or a topic. I was like, right now I'm doing this whole healthcare series. So, use like prior authorizations or deductibles or surprise billing, or I'll just pick a topic and then I got to do some research on it. So there's a lot of, honestly, social media research is a big part of it. Like what are people complaining about? What are insiders, people that are in it, talking about? Even if it's like cardiology, like what do cardiologists, what are their pet peeves? What are they mad about with getting consults, or what are the latest arguments between cardiologists and nephrologists, stuff like that. So I'll do a lot of research just to get a sense for what the issue is, and that helps my material be more authentic, which is some feedback I get a lot. It's like, it's really like that, like that's, and then it's just about sitting down and just writing out this, coming up with jokes back and forth, writing it. So once I have the script written out, which it doesn't take too long. Like I can probably get a script done in like a day, or honestly, actively working on it, like 2 or 3 hours, depending on the topic. But these videos are only like 2 minutes long, right? So it's not too arduous. Filming it sometimes takes longer, depending on how many costume changes I have. But I've become faster at writing material. Over time. At first I wasn't writing anything down. I was just like sitting down and filming, and it took forever because I was like coming up with a line by line and then recording it, and it's just I'm not a very organized person, but I had to become organized in my writing process just for efficiency of my time. So
one thing I find really interesting, we're going to jump to a clip. This is like a video sketch of a farmer. A farmer in medical distress. So, but one thing I found really interesting, because I was listening to it, and we only have audio on the podcast. You change your voice. Like, I can tell, even if I'm not looking at it, I can tell who's talking. Hopefully everyone else can too. But anyway, we're gonna jump to that clip now. So this is a clip about a farmer. what to do when a farmer stops doing his chores. And I'm curious why you picked this clip too. Okay, we're gonna hop to that now. I just wanted to give a quick shout out to our title exclusive sponsor, Hills Pet Nutrition. Thank you so much, Hills, for everything you do, including some of the work you do with animal shelters and pets in need. The Hills Food, Shelter, and Love program provides food to 1,000 animal shelters and has provided $300 million worth of science-led nutrition to pets in need, helping them to be healthier, and hopefully that will help them get adopted faster. They also have the Hills Disaster Relief Network, which provides food to animal shelters, vet clinics, and other nonprofits who are caring for pets in need after disasters. So that's just some of the social programs that Hills does. They're just a fantastic company. Thank you, Hills, for everything you do, including being a part of this podcast, because I literally couldn't do it without you.
All right, go ahead. What do you got? We got a 68-year-old farmer. He was building a fence and started noticing some back pain. Did his wife make him come in? No, he came by himself. He's alone? Yeah, he was worried, so he came right in. Hey, Peggy, wake up. We got a farmer who came in voluntarily. What else did he say? Well, I asked him to rate his pain on a scale from 1 to 10, and he just said, I'm here, ain't I? What? Yeah, that's all he said. I don't know what that means, though. That's because you're using a pain scale for normal people. You got to use the farmer pain scale. Is he going to be okay? Listen to me carefully. Did he finish the fence? No, he had to stop. Dear God. Peggy, get the crash sack ready. It's going down. What's a crash sack? Well, we had a crash cart, but we had to repurpose it as a hospital bed, so we just stuffed everything into a burlap sack. Hey, Doc, Jim Bob's on the phone. He cut his hand. He thinks it's infected. Hey, I don't have time for this. I got a farmer here who quit chores to seek medical care. Well, he's been using Delilah's antibiotics. She had mastitis last year. He just wants a refill. Is Delilah his wife? No, it's his dairy cow. Can you call Leroy with this? I got a situation over here. I tried. He's in the middle of a root canal. Leroy is the dentist? He's the dentist and the pharmacist. Hey, Peggy, can you tell Texaco Mike to go ahead and gas up the fan boat, please? Is Leroy a pharmacist for humans or animals? Do you think we have 2 pharmacists here? Yeah, go ahead and fax him. It might take him a while to get here. Hey, Doc, Jim Bob called back. He said, never mind. Great. What? What's wrong? When a farmer calls asking for help, you got to jump on it right away. If you wait too long, he'll say to hell with it and you'll never hear from him again. Really? Hey, what did Jim Bob say when he called? He said to hell with it. Thank you.
That was so good. Thank you. Thank you. I love that. I don't know if you picked that because you were kind of going for a veterinarian kind of.
Well, no, I picked it. Yeah, I picked that actually because, well, first of all, that's right now the rural medicine videos are like the most popular videos that I'm putting out
Really?
right now. I don't know what it is. Like, people love seeing that environment, I guess. Like they love the bare bones, kind of no frills, just trying to figure it out. You know, farmers are kind of interesting people, and I don't know, the do-it-yourself medicine. I have no idea. The genesis of the rural medicine doctor came from my experience in ophthalmology training, because I was in Iowa, which is there's a lot of rural communities. I was in Iowa City, and so we'd get farmers coming from all over the place to get their eye care done by us. And so I heard a lot of the stories I talk about, like, kind of come from, farmers, like, saying, I'm here, ain't I?
Oh,
I'm here. Like, of course I'm in pain. And they're like, they sawed their arm off or something. It's wild, like how much agricultural rural communities, how much they will do themselves. They're just very much very stoic, sometimes to a fault. And so when I made that video, the response was unbelievable. Like people just loved it. And so I kept going. I have 7 or 8 rural medicine videos. It was fun. It's always fun to draw on my own personal experiences. And I think those are really when you do some of your best comedy writing, is when you can relate to your own writing. Almost like just writing for yourself, because then it comes across as more authentic and people relate to it. And yeah, so that's why I chose that one.
All right. It made me think of veterinary medicine just because we often are, like, I'm a specialist now, but when I was in primary care, like, we are the pharmacist and we're doing surgery and then we're doing anesthesia and like we're kind of doing everything. So especially like a large animal veterinarian or a mixed animal veterinarian, they just kind of get on with it. And anyway, there was some parallels there. That.
Have you ever had an animal's owner like take some of their, or ask if they can take some of their dogs like pills?
Oh yeah. Yeah,
happen?
definitely. Oh yeah, definitely. Or just
like, can I pop a couple of these like muscle relaxers?
Sometimes you can't tell if they're joking. Sometimes you're worried. You're like, oh, we have a problem. We
Sounds
shouldn't
like a
be
joke,
dispensing.
but not really a joke.
Yeah, exactly. You're like, Or sometimes you want them to take some trazodone, and you're like, no, you can take that. That would be good. You might.
Yeah.
No, I don't mean that. Calm down, everybody. It's just a joke.
Trazodone. Do animals get sleep aids?
The trazodone's it's a don't bite people aid. It's a calm down aid. Okay. Yeah, it's a. I tell my clients, I'm like, it's like a glass of wine. Your dog's still aware, but doesn't want to.
I've met some people that could use a don't bite aid. Yeah. Sure, why not?
Just a little trazodone. It never hurt anyone. Yeah, we love it. We love that. And we give cats gabapentin, huge doses of gabapentin, just so that they'll be calm.
Oh, yeah.
It's for them. It's for us, but it's for them. Yeah.
What milligrams are we talking about with gabapentin?
Like for a cat, I couldn't believe this. Like some people give 200 milligrams to a cat.
200 milligrams.
You can't see Will's face. Everybody.
Like, yeah, I'm like, what?
Eyebrows just like, what? Or
because like the normal, like a human dose is like 300 milligrams, like 3 times a day.
I know.
That seems like a lot for a 8-pound cat. Or
yeah, that's for the car ride in. Yeah. It's better for everyone that way, though. I can tell you, because it's otherwise these cats are like, they're so upset, and
I bet.
We don't like that. We don't like that for them. So, okay, I want to talk about September.
Yeah.
Because every day in September, this is kind of a series, and it's kind of special in its own way, but every day I've been watching these. Every day in September, you released a video, and the theme is
30 days of U.S. healthcare.
Do you want to talk a bit about kind of what that is? And yeah.
It's, over the last few years, I've periodically put out a video making fun of the U.S. healthcare system, which is severely messed up in a lot of different ways. Most of my content previously had been about health insurance companies, because I've had some terrible experiences with my own health insurance company, and both as a patient and as a physician. And so I had this huge list of ideas related to, I keep a running list of like things I want to make a skit about. And I had this long list of all these like US healthcare related things. I was like, what am I going to do with all, like, this is going to take me forever to get through this. And so I was like, let me just make as many as possible and just put them all out, sequentially over the course of a month. And the reason I decided to do this, like one video a day for 30 days, is because every time I would put out a video, I'd get this huge response, especially about the US healthcare system. Like, people really resonate with those videos. Lots of comments, people telling their own stories about the US healthcare system. And so I realized there's a lot of pent up anger and frustration around all these topics. So I thought, if I just put one video out every day, then it keeps the conversation going. It's going to gain momentum, and it just will highlight having so many different, and every day is a different topic. And I could fill up 90 days, with a different topic every day. but just the volume of content I'm putting out, one a day, I hope, and it does seem like this is the case, that it's just driving home the magnitude of how terrible the system is, and what we're doing to patients, what we're doing to physicians, other healthcare workers. And so I wanted it to feel relentless, and that's what I'm going for. Now it is quite depressing. That's like, it's funny, but like sometimes I try to straddle the line between depressing and funny as much as I can. Most of it's like pretty equally depressing and funny. Sometimes it's like 90% depressing, 10% funny. Like, a couple of them are more lighthearted. Like, there's a rural medicine one that's a little bit more lighthearted. So I try to give people an emotional break during the month. But the response has really been awesome. I'm getting a lot of emails, a lot of comments from people. And part of advocacy is just dispensing knowledge and generating conversations. Because if the best comments that I get on these videos, and I've gotten a lot of them, is I had no idea it was like that. I had no idea ground ambulances, you could get billed for that out of as an out of network charge that insurance won't cover. I had no idea. It's an emergency. Why would that be the case? But it is. I had no idea that that was a problem, that that was what happens. People think advocacy is just like making change happen. And yeah, that's a big part. That's the ultimate goal, but there's steps to this. Like, first, you got to make sure everyone knows what the problems are, that they know, oh, this isn't actually my doctor's fault that I have to pay this much for this procedure. No, this is because insurance required a prior authorization that they then denied. They didn't tell me how to appeal it, or, I didn't know how to appeal it. And so education is a big part of this. I need everybody needs to be on the same page and understanding what the problems are, the ultimate source of those problems. And then once we all know that, then we can change things. Then we can, know what to talk to our legislators about, how we can educate our legislators once we're educated ourselves, and suggest changes or support certain bills to make change. And so I think we overlook the impact that just straight up education can have on the whole advocacy process. And so that's the ultimate goal of this. And I'll be honest, I'm tired. It's a lot. I don't know how some like full-time content creators do it. I guess it would be easier if I was full-time doing this, but I still practice 4 days a week. So it gets to be a slog sometimes making all this content, but I do feel like it's important.
Yeah. So do you feel like you're getting traction, that people are hearing your message? And there's a lot of things I didn't know. And mostly because I'm in Canada, and,
Yeah.
It's not perfect up here, but we don't pay for ambulances. So are you getting depressed by the content? Are you just like, well, I'm just going to keep going, I'm going to get traction? Are you hearing from politicians? Do you think that you can push this and make some change?
I have. Every now and then I'll get a response, or something from a politician on Twitter in particular. That's where a lot of the politicians are posting. They're on social media. So I've received a few of those types of messages, but also from people who do a lot of lobbying, saying that they're going to use my videos. And so I definitely encourage people to do that. Like, if you don't know how to explain pharmacy benefit managers to a politician, which honestly, who does? I barely understand them myself. I made a video about it. Send them the video, and they can almost like one of my favorite things to do is like to trick people into learning about things by disguising it in comedy. It's like, I mean, that's kind of what satire is, right? And so that's what I'm doing. I always encourage people, hey, send my videos. Send it, this will teach them about surprise billing. Like, let them know about it, or physician-owned hospitals, or whatever the topic is. So yeah, I've gotten a lot of comments about that, like people wanting to use my videos for different things, and that's great. I love it. And yeah, so the feedback's been phenomenal, and hopefully it just helps get that information out there to the public.
Yeah. I think it's kind of well, for me, I think I like comedy to have a higher purpose. So to me, I'm like, that's what comedy's for. That's what satire is for. You're sort of pointing out what's absurd, and it is absurd. Like,
Yeah.
some of the stuff I'm just like, I'm sorry, is that really true? And I know it is, but it's like you can't even believe it. And I know there's people hesitating, like, should I even call an ambulance? I don't know what's going to cost me, which is really worrisome.
Crazy, right?
I know you're telling people still, if you're going to, you need to call an ambulance.
I know. Yeah. I did a live. I did a YouTube live. That's one of the things I had to tell people. I was like, listen, like, some of the comments, you guys, are a little bit concerning. Please, if you're dying, call an ambulance, or if you feel like you might be dying, you'll get a bill maybe, but it's better that you're alive to pay it, I guess. I don't know. So yeah, it's a little bit concerning, but man, there's just so much content out there around this topic. So I don't know, maybe I'll do another month down the road, but we'll see.
You need to recover for a bit first. You talked a little bit about like conflict in medicine and conflict between departments. And again, that happens in veterinary medicine too, unfortunately. Where do you think that conflict comes from? I don't know if you can answer that, but like
egos. I think that's a big part of it. Everyone's got an idea about, I think a lot of the conflicts come from, like, each doctor has a very specific set of knowledge. They expect the people around them to have that exact same set of knowledge that they're coming to a problem with. And if somebody else doesn't have that knowledge, then that's a problem. But so I think there's a lot of just miscommunication. Also, there's a lot of moral injury right now in healthcare and burnout. And so people are just on edge, period. Nerves are frayed, and it ends up blowing up into different arguments and people being mad that they're getting consulted at 2:00 in the morning, even though the person that's consulting them actually does need help. And, it's your job to help them. And so I don't know. I think there's lots of things that go into all these interpersonal conflicts, but as a comedian and a physician, I think they're hilarious. So I'll just take it and run. And yeah, I create these shorts, but I try to do it in a way that doesn't make any one specialty feel like taken advantage of. I try to do it in a way that people can see themselves in it. It's got to be truthful, otherwise people get mad at me, right? There's got to be some element of truth to it, which is what makes good satire. So as long as there's some truth to it, I've got a lot of leeway in terms of, making fun of people. And I think that helps diffuse some of the tension between groups, is shining light on it in a comedic way, right? So I don't know. At least that's what I tell myself, that maybe I am helping out surgeons and anesthesiologists to understand each other a little bit better. But
I think you are. I mean, I think also just on the topic of burnout, and again, it's a parallel thing happening in our profession as well. I know that might sound weird, but the pandemic really affected every healthcare professional, I think, across the board. I mean, you kind of answered this, but like, how can comedy help us as healthcare professionals who are feeling burnt out, who are having mental health issues? How can comedy help us? Or can it?
Absolutely can. I mean, it's a coping mechanism. It's a healthy coping mechanism. And there's a lot of people in medicine and medical fields that have a wonderful sense of humor. A lot of times people feel like they can't show that off because they're afraid of retribution, or they're going to get piled on for something. That's another thing. It's sometimes doing medical comedy is tricky because we have a very unique place in society where we have like people's health and their lives in our hands, and so it can be challenging to try to make light of things in medicine when it's a lot of very serious things going on, right? And so, this is something I talk about. I talk to a lot of medical groups, a lot of physician groups, and I talk about how to use social media safely, without getting yourself into trouble. And so there's like certain rules that I go by, but I think the threat of being labeled as unprofessional should not deter anybody in healthcare from having a social media presence and showing who they are, showing their personality, telling jokes, using their wonderful sense of humor that we all have. We should lean into that because it's a coping mechanism. I've been using it all my life with my health issues. It's helped me. And feedback I get from my videos, especially at the height of the pandemic, was, your videos helped me get through a tough time, give me a laugh at the end of a long day, that kind of thing. And I love that feedback. That really means a lot to me. And it really has showed me over the years that we all need to laugh a little bit. We need to be able to laugh at ourselves, at each other, but not patients, right? You notice I never have any patient characters in any of my skits. I don't go anywhere close to that. It's all physician or me punching up at the billion-dollar corporations that run healthcare. And that's one of the things I tell people. Like, that's how you do it safely, right? There's certain lines you don't cross. That doesn't mean you can't be funny. Like, you can still show yourself on social media, or it doesn't even have to be on social media, just with each other, with your colleagues, just blow off some steam. And comedy and humor and telling jokes is a fantastic way to do it.
I love that. Actually, I never thought of that, but you're right. There's never been a patient. So that's kind of sacred ground for you, is that's kind of a protected
and it should
space.
be, because the minute you have a physician making fun of patients, then you lose trust.
Yep.
And the last thing we need is the public losing trust, more trust than they probably have already lost in a lot of ways, for the patient-physician relationship. We cannot undermine that trust. It's critically important. That's why I stay away from that, because it's just not patients can make fun of doctors. Like, that's fine. Like, because we got that power dynamic, right? It's something you have to really consider.
So your patients, they know who you are because you came out.
Some of them, yeah. Now, most of my patients, most of my patients are in their 70s, 80s, and 90s. So it's not exactly the TikTok generation. So I don't.
Okay.
It's not often. I would say maybe like once a week, I'll have someone come in who has seen my videos. It's happening more frequently, though. Yeah.
And then how do they receive it if they?
They love
don't
it.
Have they love it. Okay.
It's fantastic. And it made me realize, like, it's probably like all the anonymous stuff, like being afraid of getting in trouble and being anonymous on social media. I was like overblown. I probably did not need to ever do any of that, because patients love it. People love it when they see their physician have a sense of humor and they can laugh about things.
I went through the same thing, though.
Makes us human.
Yeah, I didn't want anyone to know for a while, and then I was like, you know what? It's who I am. So yeah, I can definitely relate to that.
Absolutely.
Okay, I know you have to go back to work, so I just have a couple more questions.
Sure, yeah.
You work full time?
Full time for an ophthalmologist. That's 4 days a week. That's ophthalmology full time. Yeah, that's
a lot.
That's fine.
That's surgeon full time too. So I think I know the answer to this, but you also got this whole other side, it's a whole other career, keynote speaking, working all your sketches online. If there came a time where you could give up practicing as a physician and do comedy, sketches, keynotes, whatever combination, maybe back to stand up, if you could do that full time, it wouldn't impact anything to do with your finances or your family. Would you do it, or would you keep practicing as a physician?
Right now, I would say I would keep practicing. I go back and forth on which one's more fun.
Oh, that's great.
Yeah, sometimes being a physician is more fun. Sometimes doing the social media stuff and the speaking is more fun. But they both have their faults. On the medicine side, there's all like the administrative stuff, all this health insurance stuff that just is really irritating as a practicing physician. On the social media side, it's the need to continue making content, and that it's easy to feel like you're doing it, just because you have to, not because you want to, especially if it becomes your career. I don't know, pluses and minuses to both. I like where I'm at now, the balance, although there's not much balance. It's like literally 2 full-time jobs, it seems at times, but I don't know, making it work. As long as my family's okay with it, I'm going to probably keep doing both. It would have to take like an opportunity that I just can't pass up on the social media side, on the Glaucomflecken side, whether it's the opportunity to do we've talked about like an animated show or some big tour of, a live show, or I don't know what it is, but it would have to be something very, very special to really seriously think about cutting back on the medical side. The other thing is, so much of my comedy is wrapped up in medicine and practicing medicine, that if I gave that up, it wouldn't be as authentic.
Yeah.
wouldn't resonate so much with so many people. I think what gives me cred is because I'm in it. I'm in it with everyone else. I'm there. I am also experiencing all these hardships with the healthcare system that everyone else is. So I almost can't even extricate the two from each other.
Okay. No, I love that answer. It's a great answer. We're going to put in the show notes how to find you. I think unless you're living under a rock, you're not
Just
really
Google
that hard to find.
Glaucomflecken. It's spell it like it sounds. Glaucomflecken. It's easy.
But people can find you. But is there anything like besides? I mean, I think everyone should watch your videos. The September Everyday 30 Days of Healthcare videos. Is there anything else you wanted to promote? Anything else that's going on with you?
No, not really. I mean, just I'm going to keep making videos. We got a podcast that's called Knock Knock Hi with the Glaucomfleckens. You can find information about that. You can find it anywhere that you listen to podcasts, but our website is glaucomflecken.com. So it's a podcast I run with my wife, Kristen, Lady Glaucomflecken, and we're really excited about it. It's just a lot of fun. It's kind of longer form stuff. It's funny. We talk about stories and have interesting guests on. And so check that out if you like podcasts. And then, as far as content goes, social media, YouTube, TikTok, all the things. I'm pretty much on all of them.
You are. You're on all of them.
Yeah, I have help. I don't, it's like we had to hire someone to help me post on all the different platforms. So it's just too many. I don't know what I'm doing. I'm just flying by the seat of my pants here.
Same.
Just take it as it comes. I don't know. I'm not a very futuristic thinking person. I'm like, what do I need to do today? So I haven't even thought about what my afternoon is going to be like today. I think I do have to go back to work though, eventually.
Okay, I'm going to let you go back to work, but there's one more question. It's the last question that we ask every guest on Co-Medicine. Okay. If you hadn't agreed to be on, there might have been a campaign to get you to come on. But you said you would come on the show. So now I'm focusing my attention on Dr. Ken Jeong. No, it's not funny. That's serious. It's serious. So now you're not.
You and me both. I'm trying to get Ken Jeong on my podcast.
Fine. You can invite him on both. But this question is, you're not talking to me. You're not talking to anyone. You're talking directly to Ken Jeong. Could you please tell him why he should come on the Co-Medicine podcast?
Any comedian loves to hear themselves talk. It's like a prerequisite. So I'm sure Ken Jeong is no different. So, hey, Ken, you want to come in and just hear yourself talk for a while? That's great. I mean, Sarah's great too. Like, she's fantastic and asks great questions. But it's all about you, Ken. And so Phil, come in. It just get that ego going a little bit. It's nothing wrong with that. You're a successful, smart guy. So definitely come on and enjoy it.
All right. And Ken, we'll even do a 2-for-1.
That's right.
You can come on both of our podcasts. You're invited.
Exactly. We can't give you any money, but we can
exposure.
Exposure. You get all kinds of all the exposure you need from two kind of podcasters who are just getting started here.
I know that's why Will is here, just because he needs more exposure, because he only has 2.2 million followers.
No, I came here because I have a big fan of veterinarian oncologist comedians. So
there you go. It's very niche. It's very, very niche. Okay, well, I cannot thank you enough. I actually, when you agreed to come on my podcast, when I got your email, I let out a little squeal. I was so excited. It was like an audible beep. That was like how I felt then. It's how I feel now, having had a chance to talk to you and get to see you. So thank you so much for being on the inaugural season of Co-Medicine. Thank you so much. And now it's time for you to go back to work. Thanks, Will.
Thanks.
And that wraps up this episode of Co-Medicine. I've been Dr. Sarah Boston. Thank you so much for listening. I just want to give a big shout out to our exclusive title sponsor, Hill's Pet Nutrition, for helping to make this podcast possible and for supporting veterinarians and initiatives like this. Really, literally couldn't do it without you. I want to thank musical genius and stand-up comedian Mark Edwards for making music that somehow makes me laugh. I don't know how he does it. Please check out his info in his show notes. He is a stand-up comedian and actor. He's absolutely hilarious. And big thank you to my producer, Heather McPherson from Twisted Spur Media, who just seems to make everything work and everything sound great. And I also couldn't do this podcast without her. Thank you for listening. I hope you're having as much fun as I am. That might actually be hard because I am obsessed with this podcast. If you enjoyed the podcast, please let us know, let your friends know, give us likes and nice comments, do all the things, help support this new podcast. If you didn't enjoy this podcast, I don't know what you're still doing here. You know what? If you didn't enjoy it, you can just do nothing. Nothing would be good. We will see you next episode. Thank you.